Record. So welcome everybody. Thank you so much for your patience. This is Sue Grinnell, and this is the second in our series of 4 TA web discussions based on data. This particular web discussion is on the public available use of data sources to track outcomes. And so again, Rebecca Garrow and Kylie Gellington, who are in Sacramento today, will be walking us through this information. And again, if you have questions, please feel free to ask and also use the chat box if that's more comfortable. So with that, I'm going to turn it over.
Thank you, Sue. Can you hear me okay?
Yep, I can.
And Sue, will you be monitoring the chat box and will you let
Yes.
us chat?
Yeah.
Oh, excellent.
Yeah. And then if you, all the participants, if you want to put yourself on mute, you know, just if you have, you know, stuff going on, it's just helpful.
Great. Okay, well, thank you, everybody. And again, I apologize for the late start. This was my fault entirely. Thank you very much to Kylie for snagging a laptop and getting us set up in a different conference room. We got double booked and overbooked, and I'm happy to be off you now, but I apologize for the late start. Today, as Sue said, we are going to be talking about using multiple public health use data sources to track health outcomes, including social determinants of health and disease prevalence, hoping that this will help you with your sites. We're going to be talking specifically and going into some detail about websites that provide public use data resources. We're going to talk about how to access these public use data and actually go through a couple of examples, and then talk about, once you've obtained the data, ways to monitor and report results from these public use data sets to track your outcomes. This is the same slide for those of you that joined us on our last webinar. We just want to acknowledge that all of the catchy sites are starting at different points. For some of you, in terms of using public use data sources to track outcomes, this will be your first at bat. Some of you, you're on third base, ready to be waved home. You've been using a lot of these data sources. This is going to be old hat to you. And for those folks that have a lot of experience in this, we're hoping that you identify yourself on the call so that you can provide examples of how you've used these resources, and also serve as sort of an expert to some of these other sites, to where we can maybe collaborate in the future on additional resources that you may have used. We're just going to talk about a few of the popular ones today. Hate to disappoint, despite our late start, this is still going to be a short presentation. This is a high-level overview, just like our last presentation was. We are going to budget time at the end of this presentation to answer any questions you may have about your specific project, issues you've run into. This will also be an opportunity for those of you that have used these public use data resources or other ones to share about how they've been beneficial or challenging to your programs. And just a reminder, technical assistance is always available to you by our research team. We are happy to help you locate data sources and provide advice on how to use data moving forward to inform your programs and outcomes. So, starting off, we just want to cover a few common California health data sources. The California Health Interview Survey is done by UCLA every 2 years. It is one of the largest ongoing surveys in the world. It breaks many health topics down by county. It's very helpful for sort of getting some secondary data resources on a county-specific level. Likewise, the Behavioral Risk Factor Surveillance System is a national survey that also provides county breakdowns, and sometimes by race and ethnicity as well, where we have larger population numbers. One thing that we're really excited about is the UC Merced Economic Burden of Chronic Disease in California. So this talks about the cost of chronic disease. This can be a really good return on investment discussion with funders and partners. There's the United States Census, or the American Community Survey. We're not going to go into detail on that resource on this webinar, but if you are interested in using the query system to get some population numbers or other demographics or economic indicators for your county, we can assist you with that. There are also several morbidity and mortality specific databases. There's lots of free vital statistics available from the Department of Healthcare Services and the California Department of Public Health. The California Health and Human Services Open Data Portal has a wealth of data set information ready for you to use, as well as county health profiles and the Robert Wood Johnson Foundation County Health Rankings and Roadmaps. We know that many of you are familiar with those. We want to talk a little bit about the pros and the cons of these public use data sets. Let's get the bad news out of the way first. There are data set limitations with all of these. There's usually large sections on all of these websites that talk in detail about the limitations. Many of them are not representative for the specific communities that you may be working with. There's also the frequency and the lag time of a lot of these data sets. This is not current up-to-date data many times. So this isn't what happened a couple of months ago or a couple of weeks ago. A lot of times this is data that was collected years ago, and especially for some of these large surveys, collecting, cleaning, and then producing data and statistics that are meaningful for people, it is not done in real time. It may not be statistically stable or representative for your catchment area or for your target demographic. I know in a lot of our works with tribes and tribal health programs, this is a big struggle for us. This group kind of becomes invisible in some of these large public use data sets just because there isn't enough statistical significance or power to represent them. This is secondary data, and so it may not capture the health information you need. So we've talked a little bit about primary data and secondary data. Primary data would be data that you collect. It's specific to your program. It's measuring what you need. It may be working with your partners or your clinics. Secondary data is data like these data sources that we just reviewed. It can be useful to your program or project and can provide insight on some needs, but it's not collected specifically for your program. Likewise, year-to-year variations can limit comparisons for these data over time when we're looking at these large data sets. The pros. It's free. Many of these cost you $0. For nonprofits and public health organizations, that can be really helpful. This data is cleaned most of the time. These resources will be showing you are clean. And when I say cleaned, it means that any missing variables have been accounted for. It's ready for you to analyze. It doesn't require any further corrections. It's quick and it's ready to go. A lot of these query systems can actually produce tables and graphics for you that you can utilize in reports or in informing decisions. It's usually easy. I think we're going to go over some easy examples and some more complicated examples. They provide a good starting point. It may not be perfect, but it can help give you an idea of where disparities or areas of priorities or area of strengths within your catchment areas may be. We usually have adequate documentation of how this data was collected and what it can be used for. And the frequency we listed in a con, but it can also be a pro. Like we said, the California Health Interview Survey is done every 2 years, and they've actually structured their database to where you can aggregate years. So we can look at trends over time, year-over-year comparisons, or pool data for multiple years to get a stronger sense of the representation. The ultimate goal of all of these secondary data sources, though, are to use these public data sources, your own collected data for your programs, qualitative data that you are either officially or unofficially collecting anecdotally from your partners, from the community you're serving, and real-time quantitative data together to get a picture of the health of your catchment area. So basically, this is just one of many tools that you can use to help make informed decisions and track outcomes for your sites. So I'm going to pause really quick for questions. The next couple of slides in here are going to be where we're going into specific data sites and just sort of reviewing some of these variables. Are there any questions moving forward or anything in the chat box, Sue? Great. So first we are going to talk about the UC Merced economic burden of chronic disease in California. Sue, can you please confirm that you can see this website? clarification. Sue, can you please unmute?
Oh, sorry, I was muted.
Yeah, no, okay.
I was just talking. Sorry. Yes, I can see it.
Okay, wonderful. So this is from the University of California, Merced. We're going to go through a real-time example here, but before, for those folks who haven't used this before you do that, we recommend you skim this before you begin. It'll just talk to you about how to download and customize the request, and it'll give you some resources for understanding what these numbers mean and how they came up with them. Let's look at the economic burden of chronic disease in California for Sacramento. So this can help estimate the cost. So for the diseases, today we are going to select diabetes. So I'll check that. Actually, I'm going to check two. We're going to do diabetes and depression. The regions, I want to look at the Sacramento area counties because that's where my catchment area is. If you didn't want to select a large region like that, many of you may select specific counties. You can see this automatically selected the 4 counties that are represented in the Sacramento region. You can uncheck or select more counties and refine it so that it's at the county level that's most appropriate for you. For ethnicities, I want to look at all races and ethnicities. For the age group, I also want to look at all age groups, so I'm going to select all. And I'm going to look at both males and females and click search. Easy peasy. So total disease cases is 328,000, and they estimate the cost of this at being over $1 billion. It talks about the totals for all diseases selected for each region. Then it goes down for each of these counties. It breaks it down by every race, every age group. So it talks about the number of cases that are represented in each one of these areas and about the cost. So I'm going to scroll down a little bit just so you can see the wealth of this. This can all be downloaded in a CSV file. These are the totals. You can see because I selected 2 diseases though, it also breaks it out just for depression and for diabetes. So if I go to my diabetes tab, I can see the number of cases represented in these 4 counties, just under $1 billion, and it'll talk specifically by race and by ethnicity. So this is pretty self-explanatory, but are there any questions, comments, or concerns, or any stories that people would like to share who have used this database before?
Have some of you seen this database or used it, or is this new for you?
I had heard about it, but I hadn't actually looked at it, so this is very helpful.
Yeah, great. Yeah, it's nice because it's got the counties and all of that, so yeah, it's great.
Okay, we're going to, let's see, move on. Okay, thank you. Okay, so again, as we said before, the utility of this, it's great for a return on investment discussion. So when talking about the importance of addressing some of these chronic diseases, actually showing the economic burden for your catchment area can be very, very helpful with partners. Okay, we're going to talk about the California Health Interview Survey now. Let's go to the regular, not that one, but ask. This is the neighborhood. Yeah. Okay, so in talking, I have to do something with this. Okay, California Health Interview Survey is something many of you have potentially used before. This is, again, that survey that's done every 2 years. Again, we encourage you to go and look at the methodology of this survey so you can understand the limitations as well as the representation. We can help you understand that for some of your counties, but especially for some of these large urban counties, this can be a really great tool for you to obtain data.
All right, let me just make sure that it's sharing properly. Okay, I'm sorry, I don't know. No problem.
Okay. Sorry, we're getting like flashing messages with our Zoom application, and we're just hoping everyone can see what we're doing. Okay, so Same thing, I'm at the Ask Chiz. You're going to need to create a username and password to use the Chiz system. It's free, but you will need to log in each time that you use this data. So instead of searching all of California, I'm going to look just at my catchment area, which is Sacramento. Next. I'm going to select a category that I want to look at, and I am going to go with tobacco use. So if I go here to health behaviors, I have tobacco smoking. And then here on the right is going to show me all of the variables that Chiz has collected for smoking for all of their surveys. So actually we'll kind of maybe scroll through two of these examples, but we have current smoking status for adults. We identify if anyone's ever smoked an e-cigarette for teens, current smoking status for teens. And we can see that all these data are collected multiple years up to 2016. Scrolling down a bit. If you've smoked for 1 or more days, if you've thought about quitting smoking, just for demonstration purposes, I'm going to go here to height and weight. We can look at the body mass index, and they break it down by the World Health Organization definition. If you are overweight for your age, not factoring in height, we have it for teens and adults, health behaviors for height and weight for the body mass index 2 level. This only goes up to multiple years, up to 2009. So essentially there's a ton of data. Let's not get overwhelmed. Let's go back to our smoking example. I'm going to look at current smoking status for adults. So once I select this variable, it tells me all the years that this data were collected for. So this can be helpful if you're looking to maybe do a trend analysis for your catchment area. It tells me the age group, and the results are displayed. This is how your data is going to look. So are you a current smoker or are you not a current smoker? It's not identifying if you are a former smoker in this category. So this is the 2 level, not the 3 level, but we'll look at this variable just for demonstration purposes. I'm going to go on. We can also do a comparison. So I can compare smoking status to whether you have insurance. I can look at it for male or female. I can select any other numbers of categories. So I can sort of do cross tabulations between smoking status and BMI, or smoking status and alcohol consumption. So that's another option. We're not going to do that right now, so that we have a nice simple table. We can limit our population. So we can include all ages, or I could potentially just look at adults from 18 to 24 if your catchment area was for, or if your target demographic included those age range. We can separate it by gender. We can include all races, or we can compare races. And we can also restrict it by federal poverty level. So this is helpful too. We're going to leave that all open for right now. And I'm going to move on to years. Oh, whoops. Go back to my years. For our years, this is where we were talking about, we have multi-year options. So I can actually select more than 1 year for this data source. So I'm going to select 2016, 2015, and 2014. And what I want to do is I don't want to compare, but I want to pool this data. So this is going to make my estimates stronger for Sacramento. So I'm going to pool the past 3 years of data that they have available, and then go to my result. So we have current smoking status for Sacramento County. This is telling me that it estimates in Sacramento County about 15% of the population is a current smoker. It gives me the range. About 85% are not current smokers. And again, it gives me the 95% confidence interval range. This is these 3 data sources pulled together. It also provides me with a chart, which is downloadable. If I were to select multiple years and do a trend analysis and say to compare all of these, it would do that. This table is not going to work. There's just 2 dots for the yes and the no, but that's something that's possible. One thing that might be nice is instead of limiting population, let's say I wanted to look at maybe not smoking for everybody, but maybe just for the Latino population, the African American population, and the American Indian, Alaska Native, non-Latino population. Still pulling data. Oh, wait a minute. So this is showing that information just for these three groups. What I would actually like to do is not limit the population, but compare the population. So let's do that. Yeah, so let's compare by demographics, race and ethnicity to the OMB Department of Finance. So now, instead of pooling those three racial categories together, it is breaking this information down for Sacramento County by the OMB Department of Finance definition of race and ethnicity. And so this is going to be a helpful example because we're going to see some red dots here, which says that this is a statistically unstable estimate. So we do not have the power or the population numbers to break down this specific cross tabulation. So we see some unstable estimates here. So for the Latino population, this gives us an idea. It is not a stable or statistically representative estimate. We do have enough power for our African American and our white non-Latino populations. For the other races and ethnicities, we are getting statistically unstable estimates.
Rebecca?
Yes.
The chat question, I think you can download these, right? So the question was, can you export that into like MailChimp, which is one of the newsletter, email marketing tools that they could actually place in there to send out?
Yes, so right up here on the right, we have a few little options right here. So we can email these results. We can export these results, and that will export everything. It will export your data table, and it will export your data chart. So it automatically produces a chart right here for me too. There's a print option here too. Did that answer the question? Is that what they were asking?
Yeah, I think so. Kate, is that, I think we got it. I think that's what she was asking, so.
Excellent. Okay. I'm going to move on and look at the Ask Chiz Neighborhood Edition. So for those who like graphical displays, this can be another really great data resource for you to sort of graphically display some of your results. So let's see, data charts trend. So I wanted to look at, let's see, a health topic. So this was Ask Chiz, the query system. This is Ask Chiz Neighborhood Edition. And when you go to the Chiz website, it will give you two options. So this is sort of a separate browser window, but it's just a visualization platform. So I want to look, because all these people around me are coming home sick, I want to look at the flu vaccine. So I've selected my topic, received the flu vaccine. So children ages 6 months to 11 years who've had a flu vaccine in the past month. It's giving me this result for California, and it's saying 55% with a confidence interval of children within this age range have received a flu vaccine. So let's add a location. I want to look at Sacramento. And it's giving me options. So I'm going to look at Sacramento County. I think I also want to look at just the cities of Sacramento and West Sacramento. Because we're in the area, I want to look at Woodland as well, which is in Yolo County right next to Sacramento. So once I've brought this up, it is going to, sorry, my computer's freezing a little bit. There we go. So we can see the statistics for the state of California, Sacramento County, Sacramento City, West Sacramento, and Woodland, giving you a little sort of pop-up information about each one. It's providing me with this, it's providing me with a little table. Sorry, we're having more Zoom problems too. I'm zooming out a little bit, but it's also providing us with a map in Sacramento that's kind of graphically showing. And when I hover over it, it's giving me the estimate and the confidence interval as well. And so this is for the entire county of Sacramento. But when I go on the census areas of Sacramento, the Arden Arcade area, Rancho Cordova, Carmichael, Rio Linda, it will also give me those estimates. So yeah, this is just a nice tool, and these results can be downloaded too, so that you can graphically show different health outcomes for your catchment area. Any answers on that? Sorry, our computer screen's a little bit glitchy right now. I hope everybody can see this. Okay, great. Has anybody used the Ask Chigs Neighborhood Edition?
And Rebecca and Kylie, so with the neighborhood one, I know you're out of it now, but so all of those different indicators can show up in the by the zip code?
So not everything that's represented in the Ask Chiz query system can be represented in the neighborhood, but everything we saw on the left, let me go back to my screen up there. Everything over here on the left in terms of health topics, environmental factors, and socio-demographics can be displayed there. So just more examples, socio-demographics, we have mobility, we have poverty, we have race, we have work status. For environmental factors, we have the Cal Enviro screen. I actually don't know what that is. I tend to stray more in the health topic area. Sugar drink ones, 2014, yeah. Good tool.
Yeah, I'm wondering if that is referencing like the Environmental Health Tracking Network, which also has, you know, I'm wondering, I'll have to look at that because that's a GIS tool as well. So.
Right.
Okay, thank you.
Yeah, good question. Okay, California Health Interview Survey. We also have the California County Health Status Profiles, and I would imagine, Sue, potentially you could confirm that most folks are familiar with these and have accessed the profile that their county is.
You know, I'm not sure if they have or not. We did, you know, when we do the metrics web discussion, we will be showing a crosswalk between those metrics and the Let's Get Healthy and the core metrics. Mm-hmm. I'm not sure, are you guys familiar with this data set? I think Christina and Lake County or Long Beach, you know, are you guys familiar with this? Because you're from a health department. Christina, is that something you're familiar with? I don't think she has, she's not, but it's really exciting.
Okay.
Well, good.
We're excited about data all the time, so we're glad to have other parts.
Yes, we are.
So these county health status profiles for 2017 are available online. We encourage you, we're not going to go through them here. We'll provide this link in the PowerPoint version that Sue sends out after this webinar. But this is what the website looks like, and this is where you can find your county health statistic profile. And you can get for your county or counties age-adjusted rates and morbidity, mortality, conditions, and other public health related categories. There's 3-year averages. It's a pretty good data source, and it lays them out all nicely in the report. So it's a good resource and tool for folks to use. Oh, so what are you saying?
If you just go to the PowerPoint, it should still be shared. You just create the whole thing.
Okay, so that was the California County Health Status Profiles. And just to build upon what Sue was speaking about, this is the crosswalk document that we have. So this talks about core metrics, the Let's Get Healthy California, and the California County Health Profiles. So just sort of the general domain of all of these metrics for measuring health, and how they compare across these three resources. So this is something that we'll be providing to you at a later time as well, but it can kind of help you get an idea of where to start and which metric might be good for you in making decisions and for planning purposes. Anything to add to this, Sue?
No, just the core metrics on the left, those are the 15 metrics, and the 9 sites will be getting that data for each of your counties. And then we just crosswalked because the Let's Get Healthy is a big measure set, and then Rebecca just was referencing the county health profiles. There is some overlap, but not a lot that's here.
Great. Okay. There is also the Open Data Portal. Right. Okay. The California Health and Human Services Open Data Portal. There are an overwhelming number of data sets on this website available for your use. Let's kind of just go through a quick example of one. So again, just looking at the Open Data Portal. Facilities and services. 54 data sets found within this category. WIC authorized vendors. I liked this one, the seismic ratings and collapse probabilities of California hospitals. So all of these are going to be downloadable in a CSV, Excel, or Word file. Let's look at the seismic ratings one. Seriously, I was looking at this, I was like, wow, you know, I'm kind of interested. I'll look at the seismic one. Yeah, it's terrifying. So we've got the data dictionary and the actual data set. So the data dictionary will actually give you a description of all of the variables, what they mean and how they were collected. The data set is going to be the raw data available for download, and you have this additional information here. So let's preview this data set. So this is what these are going to look like. So you're going to be able to sort them here within your web browser. You can also download these data files into Excel and do some of your own data analysis. They're going to have county codes. So for this one, the facility name, the building name, SPC rating, the hazardous score, and the data dictionary will describe what all of these variables down at the top are. I'm not going to get into this too much. There is a search function within this site that can be helpful if you're looking to search for a specific variable or data set. Search from 276, diabetes. So 11 data sets were found for diabetes. So adults with diabetes, rates of preventable hospitalizations for select medical conditions by county. So there's just a wealth. Time to Bike to Work from 2001 to 2011. We'll have to look at that one, Kylie. Okay, there's a lot here. You can really nerd out on this website. But so this is another resource for you to obtain county level data. It can be overwhelming if you know what you're looking for and aren't just looking into perusing data sets like us researchers do. Then we can help you identify a good data set that can help you find information to inform your program or outcomes. So I'm going to go back to my PowerPoint. Okay. So that's the Open Data Portal. And that is going to include a lot of the Department of Health and Human Services morbidity and mortality data as well. Just wanted to point that out. So a lot of vital statistic data. Did anybody, this sort of concludes the section where we were going to review some of these major public use data sets. Did anybody have any questions or experiences they want to share with these data sets or about any of the other data sets that we mentioned before but did not do a demonstration of?
Any questions, comments? Can't wait to get off of this web discussion so you can play with data.
We know it takes, everyone's like, yeah, I'll be delegating this to our research staff on. Okay. Kind of nearing the end here, we wanted to kind of close out by talking a little bit about data sharing agreements and just providing sort of an overview. Kylie and I know that a lot of our structured group interviews that we've done with many of you, we talked about data sharing agreements, and a lot of sites were interested in getting data sharing agreements, especially to get that real-time data with some of your hospitals and clinic partners. So just sort of some best practices, or I guess, you know, this is just sort of our experience with data sharing agreements that we wanted to kind of go over here. Data sharing agreements, in addition to just helping you facilitate the analysis or obtaining of data sets, they can help clarify roles and responsibilities of involved parties. So who's going to have access to data, who's going to analyze the data, what we'll do with the results. This can kind of help inform publication plans and authorship roles. It can state your goals for the specific data sharing needs. So this can also kind of help provide clarity on what you're hoping to accomplish with your programs. It specifies the types of data to be collected, shared, and or analyzed. Just sort of a best practice in research is that we always kind of want to use the smallest data set possible. We don't want to be providing access to all variables and all people and protected health information if it's not necessary. It's just a good security measure to provide the most limited data set needed to do the functions that you need to look at your program outcomes and do some program planning. This can outline access to and confidentiality of the data and the data sets. For those of you who like to get into the weeds, it can provide lots of legalese, and it can really outline who's responsible for the data. It can really help you outline your security measures if you do have protected health information for making sure that it stays secure. The Centers for Disease Control and Prevention does have some good resources. If you just need a starting point for data sharing agreements, they have a data sharing agreement and also an interagency data sharing agreement. So these are just templates that you can download online. You may not use them exactly, but at least they can give you an example of some of the templates that CDC uses for agreements and interagency data sharing agreements. That concludes the PowerPoint component of our presentation. As we said in the beginning, we wanted to make sure we budgeted time within this period to answer any specific questions you may have about public use data resources. We also want to invite anyone who has either success stories or challenges in using public use data resources to inform their program to please jump on the line and share that. Yeah, basically just provide an opportunity for dialogue at this point.
Great, thanks. Yeah, so questions, comments, anything that strikes you about any of this that you'd like to bring up? If you're talking and you're on mute, I can't hear you.
This is Sue Kincaid in Fresno, and I just found this to be a really helpful overview as so we know about the resources out there, because I may not be pulling the data myself, but I may be working with a consultant or with our work groups as we just decide where we're going to, what outcomes we're going to use for our different strategies, and then what data we have access to, and making sure that it's data we can access, you know, 2, 3, 5 years down the road.
Great.
Absolutely. Thank you for saying that. We're glad to hear that.
And other things maybe that you didn't see. I mean, there are other pieces. I'm assuming, Rebecca, I've not played a lot in the open data portal, that the reference I was talking about to the environmental health tracking network is probably showing up in there, but that's another one that if you're not familiar with it, is good to really look at and kind of see. It's, you know, different types of data than maybe you're used to looking at. So.
This is Rebecca, and I guess one thing we want to offer to the group too, or reiterate, this can be exciting. It can also be overwhelming. There's a lot of data out there. There's really good sources of data for tracking program outcomes that are secondary public use data sources. If you are feeling overwhelmed and just don't even know where to start, give us a call. We do this all the time. We analyze large data sets for multiple clients and may be able to quickly point you in the right direction for some fairly easy to use data queries that you can use for your program. And if you have specific races and ethnicities that you're looking at, we can also help point you to a use for data sources that maybe oversample some of these target demographic areas. So we're always available by phone or email if you just want to bounce some ideas, or if you're working with a contractor and want to provide them just some different areas to start.
Great, thanks. Thanks, you guys. Well, if there aren't any questions, I don't want to keep you any longer. I have been recording this, and we'll send this to Yvette, who right away downloads it, and to our YouTube channel. We have a YouTube channel, and then she posts that on our website with the slides. So I know I got a bunch of questions whether or not the slides were going to be available, so they are. So great.
Awesome. Thank you, everybody, for participating. If you have any questions post-webinar, please give us a call or send us an email. We'd love to solve your data queries.
That's right. So Data and, Rebecca, and I was calling you Data, Rebecca. So Rebecca and Kylie, what's the, you want to just speak just before we close? So next week, we have our third web discussion.
Yes, we do. Let me just confirm what the topic for that one will be. Okay.
This one is on database development.
Okay.
That's right.
Yeah, to organize and track outcomes. So you're going to be walking through how folks might do that.
Yes. So, I mean, again, with all of these webinars, we're really interested in hearing from people on the phone or participants maybe ahead of time. If you have had questions or concerns, or again, successes with designing a database that stays clean, has good fillable entry, we're just going to be going over the basics again, talking about advanced statistical analysis software like SPSS, SAS, and Stata. I'm a big fan of Excel. I think the majority of our public health analyses, just for simple program planning and sometimes outcome tracking, can be done in Excel. You can do advanced statistics in Excel. We'll talk a little bit about SQL and about Microsoft Access databases. But again, just sort of an overview and maybe a starting off inspiration point for people as they start to get ready to collect their own data, get their data sharing agreements in order. And I think we'll kind of talk about just some best practices with data, especially as researchers who work in an environment where we have multiple people working on a data set at one time. Just best practices that we use to make sure that things don't go corrupt.
Okay, great. Thanks, everybody.
Thank you.
Thank you.
Thank you.